Hello, I'm here to talk about the importance of reducing non-medically necessary deliveries before 39 weeks of gestation. Since the late 1990s, early elective deliveries have increased dramatically. A landmark study published in the New England Journal of Medicine in 2009 found that 1/3 of scheduled deliveries less than 39 weeks had no medical indication. Deliveries that occur before 39 weeks can pose health risks to both mothers and babies, and they should not be performed unless they are medically necessary. Many mothers are unaware of these risks and of the importance of delivering at 39 weeks or later, which creates a challenge for healthcare providers. A state law passed in 2011 directed the Texas Health and Human Services Commission to reduce the number of non-medically necessary deliveries before 39 weeks. In keeping with that law, Texas Medicaid and its managed care Medicaid payers no longer reimburse for non-medically necessary deliveries before 39 weeks. In order to comply with the new law and to protect the best interests of mothers and their babies, healthcare providers can do two things. First, counsel women early in their pregnancy and at regular intervals thereafter regarding the risks posed by deliveries before 39 weeks. Second, and with your hospital, develop a clear decision-making protocol to determine the medical necessity of deliveries before 39 weeks. As part of that protocol, develop best practices for handling patients' concerns about deliveries before 39 weeks. Beginning early in a pregnancy and at appropriate intervals thereafter, counsel your patients regarding the risks of delivery before 39 weeks, such as an increased risk that their baby may need neonatal ICU care or prolonged hospitalization. Provide the information in a one-on-one setting throughout the pregnancy and not only at the last weeks of gestation. Beginning discussions early in the pregnancy allows for timely review of the facts and helps manage patient expectations and planning. The role-play scenarios you're about to see model effective communication methods between doctor and patient and among healthcare providers. There are examples of purposeful, unhealthy interactions and practices to avoid, and others that demonstrate a successful decision-making protocol in action. For the purposes of this video, patients and staff are in character to illustrate effective counseling and decision-making protocols. What they say does not reflect their personal situations. Good morning, Linda. I'm glad you're doing really well today. It looks like you're about 14 weeks gestation. Everything's looking really good so far, but I understand that you've stated a desire to have your delivery scheduled in mid-November so you can avoid the holidays. Well, that would put you at about 37 weeks gestation. I want to share with you some information about the importance of delivering your baby after 39 weeks.
Well, when I had my first baby several years ago, my doctor induced my labor, I think 3 weeks early, and everything went fine.
Well, Linda, there's been some recent research that has shown new information about the risks of deliveries before 39 weeks. We didn't have this information when you delivered your first baby. There's increased risk that your baby would be admitted to the neonatal ICU, have respiratory problems, low blood sugar, and even infection. And in fact, these potential risks can create additional health and financial burdens for you and your family. I want to be really clear with you. The decision to deliver at full term is really in yours and your baby's best interest.
Yes, but I have a friend who had an early delivery that was scheduled and everything went fine.
And well, it's appropriate to deliver a baby early under certain circumstances when there's a clear medical need to do so. Conditions like high blood pressure or severe fetal growth restriction. I want to emphasize that it's really best for you and your baby to give birth at 39 weeks or later. Even though a lot of patients want to have scheduled inductions, honestly, waiting for spontaneous labor is best. And the good news is that we have a lot of time to look at the calendar and find the best date after 39 weeks, like the week after Thanksgiving.
I see.
Well, Linda, I'm glad we're starting this discussion early in your pregnancy, so there'll be plenty of time to address your concerns over the coming months. I'm going to give you some information about some local childbirth classes and other resources that could help address any concerns you might have.
I'm glad you explained this to me. Thank you, doctor.
The next set of role-playing scenarios demonstrate the importance of developing a decision-making protocol to determine medical necessity for deliveries before 39 weeks. Developing a decision-making protocol helps to clarify the chain of command, record events, and track progress. Since no two hospitals are alike, each hospital must develop its own unique set of guidelines tailored to its needs. Communication is critically important. Doctors can misperceive nurses' requests for more information or medical indications as disrespect. Doctors' frustrations about perceived roadblocks to best care for their patients can be interpreted as impolite. A clear decision-making protocol protects mothers and newborns and reduces the need for neonatal ICU admission and extended neonatal hospitalization. To ensure an effective decision-making protocol, clear and respectful communication is necessary at every stage of the process.
So I understand you would like us to induce labor by September 1st. That's 3 weeks early. Only 37 weeks into your pregnancy.
I know, but that's when my sister's going to be in town and I really need her help with my 3-year-old. I don't think I can do it without her.
Well, as we've discussed, the best thing for your baby's health is to deliver no earlier than 39 weeks, unless there's a medical reason.
I know that's what we talked about, but as we get closer to delivery, I'm just feeling so overwhelmed. My back is hurting, I'm not sleeping well, my 3.5-year-old daughter is acting up, and I just don't know how I'm going to manage everything without my sister's help.
I see. Let me think about it, and then I'll see what I can do for you.
Okay, thank you.
Physicians must be clear in indicating gestational age when scheduling a delivery before 39 weeks. Using the estimated date of delivery allows for a more precise calculation of gestational age. And after a physician schedules a delivery, medical necessity must be indicated if that scheduled delivery is earlier than 39 weeks. But is this patient's request a medical necessity?
Dr. Jones, got a minute?
Sure.
Our scheduler has forwarded the scheduler request for Ms. Smith. May I speak to you about your request?
Yes.
The scheduling form indicates that Ms. Smith will be 37 weeks at September the 1st, and there was no medical reason checked off. Our policy doesn't allow for deliveries less than 39 weeks without a medical reason. Is there a medical indication?
I realize it's kind of a borderline case, but because she was having a difficult time emotionally, I scheduled her delivery early.
Okay, but you know that a delivery at less than 39 weeks can't be scheduled without medical necessity. And in the past, I believe the physician leadership has viewed psychological reasons of this sort not to be medical necessity.
I think I know my patient, and what is a medical indication and what isn't.
Dr. Jones, I meant no disrespect. You are definitely the patient's physician and you know the patient's clinical situation best. I was just letting you know what our policy is. Let's take this matter to the medical director to get his opinion.
I'm sorry I raised my voice. It's just I always feel caught in the middle with patients pushing for early delivery. I know you're just trying to do your job.
As you have just seen, it is the physician's responsibility to clearly indicate the estimated date of delivery and medical necessity. It is a charge nurse's responsibility to first verify the information in a non-confrontational way and then refer the situation up the chain of command if it appears that the hospital policy is not being followed. Both the physician and charge nurse should approach the step with transparency and mutual respect. The goal is to secure the best outcome for the patient and her baby. In this scenario, the nurse did a very good job diffusing the conflict by clarifying that she was not trying to challenge the doctor's diagnosis or clinical assessment, and refer Dr. Jones to the medical director. Perhaps even better is if she used less confrontational wording, such as, "Dr. Jones, our hospital policy states that a delivery less than 39 weeks can't be scheduled without a medical necessity," rather than, "You know a delivery less than 39 weeks can't be scheduled." By quoting the policy, the nurse avoids a doctor-nurse power struggle. Next, in our role-playing scenarios, the physician meets with the medical director. In some cases, this step could be handled by telephone.
You wanted to see me, doctor?
Oh, yes. Come in. I want to talk about this request for an early induction.
I think Miss Smith has some valid reasons for scheduling an early delivery.
I looked at the scheduling form and I spoke with Miss Wallace, the charge nurse. By the way, she felt badly that she was perceived as disrespectful. Do you feel that you and she have resolved that issue?
Yes, I remember all of our discussions we had at the department meeting, how all the staff have to follow the policy.
Good. Well, just keep that in mind, that we're all on the same team here, and our nurses have caught some very important cases. They do really respect our judgment.
Thanks, and I'll make it a point to let Miss Wallace know that everything's okay.
That sounds good. Now back to your patient. My understanding is that she wants to be induced at 37 weeks so that her sister can help at home, and she's feeling overwhelmed. Any other reasons?
No other reasons.
You probably recall our process is that if there's a medical reason that doesn't fit our pre-approved list, then we consult other experts or do some medical research. But in this case, the induction seems to be social rather than medical reasons. Am I missing something? Any reason to suspect an increased risk of stillbirth or adverse outcome?
There's no medical reason. I looked over a chart. I thought an early induction would be the best thing for her emotional well-being.
Well, based on the fact that she has requested an early delivery to avoid interfering with her sister's travel plans, this delivery is not medically necessary and frankly is prompted only by the patient's and her family's convenience. In my opinion, delivering at 39 weeks or later will be in this patient's best interest. I'm aware that an inflexible policy may lead to the unintended consequence of increased stillbirth. So, medically speaking, doctor, any concerns?
No, doctor, there's no true medical reason for scheduling an early delivery.
But if you like, we can bring it up at our next peer review meeting. My goal is to see that all lines of communication remain open and that everyone feels that they have a say in our process as it evolves. I found that if I let the patient know that the hospital did not allow the early delivery, then the patient usually agrees with that.
Based on what we just saw, had this been an actual case, the discussion and process would have been documented under the realm of peer review. Now that Dr. Jones has his answer, let's see how he handles the news with his patient, Miss Smith.
I wanted to share some important information with you. The request for an early induction has been denied by the hospital because a clear medical necessity is lacking.
Denied? Why?
I know you're concerned about your sister's availability and that you're feeling overwhelmed, but in our opinion, delivering at 39 weeks will be in your best interest medically. A lot of recent research has shown that delivering before 39 weeks increases the risk of the baby being admitted to the neonatal ICU. And there could be respiratory problems, low blood sugar, and even the risk of infection. And along with the health issue, these risks can create serious financial hardships for you and your family. I know this might not be what you were hoping to hear, but delivering at 39 weeks will be the best thing for you and your baby's health.
I know the health of the baby is the most important thing, but I'm still just really worried about handling everything.
I understand. My nurse, Laura, has some information she can share on how to prepare for bringing home a newborn while caring for your toddler, and I'll have her talk to you. Also, let me track down some resources that can offer some other advice, and then we can discuss any further concerns you might have.
Okay.
And Susie, I know we've talked about spontaneous labor being overall best and reduces the risk of cesarean. I want you to consider that option. But if you still want an induction of labor, why don't you look at your calendar and let's choose a date that's within 7 days of your due date. And we'll talk more at your next visit.
Okay, I'll think about it. Dr. Jones, I know I've been a little difficult, but I really want to thank you for all of your help and helping me make the best decision. You've given me a lot to think about. Thank you.
The best approach for developing a decision-making protocol is a collaborative approach with strong physician leadership. Once a procedure is in place, everyone involved will feel confident about the recommendations they are making and the care they are providing to patients. Good communication and keeping the focus on the medical well-being of the patient and pregnancy are important. When there are possible conflicts between healthcare personnel, it is important to diffuse these friction points quickly to avoid escalation. As healthcare providers, we need to prioritize protecting the best interests of mothers and their babies. By counseling patients early in their pregnancies and throughout gestation about the risks of delivery before 39 weeks, and ensuring that each hospital has a clear and individualized decision-making protocol for determining medical necessity for early deliveries, we will make a difference for Texas mothers and their babies.